Major funding for Carolina Business Review is provided by Grant Thornton, an international accounting, tax, and business advisory organization dedicated to serving middle-market companies. Grant Thornton, a passion for the business of accounting. Novant Health, including Presbyterian in Charlotte and Forsyth in Winston-Salem, are affiliate heart hospitals of the Cleveland Clinic, consistently ranked #1 in the nation for heart care. Blue Cross and Blue Shield of South Carolina, proudly serving South Carolinians since 1946. And by Sunoco, a global manufacturer of consumer and industrial packaging products and provider of packaging services with more than 300 operations in 35 countries.
So, as the economy continues to reset itself from 2008 into this new reality, new industrial and public policy leadership has also been emerging, or maybe re-emerging. Enter philanthropy. These more charitable organizations that deal with the human condition in many cases have experienced an even more acute reorganization during this same recovery. Welcome again to the most widely watched source of Carolina business and public policy seen throughout the Carolinas for over 20 years. I'm Chris William, and as we grapple with setting funding priorities and communal needs, this 501c3 industry has literally and seemingly had to reinvent itself, while simultaneously ensuring that even a greater population does not fall through between the cracks of society. We start this week's dialogue in just a moment, and later, Foundation for the Carolinas Chief, Michael Marsicano.
Major funding also by the Duke Endowment, a private foundation in Charlotte enriching communities in the Carolinas through higher education, healthcare, rural churches, and children's services. And by Blue Cross and Blue Shield of North Carolina. Who's responsible for rising healthcare costs? Join Blue Cross and Blue Shield of North Carolina and many others in a candid discussion at letstalkcost.com. This edition of Carolina Business Review was recorded March 22, 2013. On this week's program, Madeleine McGee of the South Carolina Association of Nonprofit Organizations, Karen McNeil-Miller of the Kate B. Reynolds Charitable Trust, and special guest Michael Marsicano, President and Chief Executive Officer of Foundation for the Carolinas.
Communities more.
Hello, welcome again to our program. Madeleine, Karen, good to have you both here. Welcome.
Thank you. Thanks for having us.
Karen, I'm going to start with you.
Okay.
You know, we've had this dialogue in North Carolina. Last week on our program, we talked about funding, and specifically we talked about funding for Medicaid and how this was going to be a big issue. And I think that's being debated pretty publicly now. What happens to your constituents? What happens to the folks in North Carolina that you worry most about? And this is not a leading question, but how does it change the way that you think about delivering services?
Well, the Medicaid conversation didn't change our focus. The Kate B. Reynolds Charitable Trust, we have a focus on increasing access to primary care for the state's low-income, financially needy population. Had Medicaid expansion happened, then what we would have turned to is trying to help organizations build up their capacity and prepare for the new wave of additional Medicaid recipients. In absence of that, we still have the same number of uninsured that we will continue to work through free clinic associations, free clinics, other organizations, fairly qualified health centers. And so now we're going to be working on trying to get those people enrolled in what the new insurance exchange or marketplace. So it didn't change our focus, but that decision changed how we're going to approach it.
I want to bring you into this, Madeleine. When you mean in your own head, and by the way, we'll give you a disclaimer. I know you either have allergies or colds, so it's okay if you sneeze in the middle of this program. What do you hear? Tony Keck was on this program, South Carolina HHS director, making the case on why they're not taking the Medicaid dollars. What are your agencies telling you? What offline, cocktail party dialogues do you hear about this?
Great concern. Great concern. More effort at matching the people they're working with the existing resources where they can. We just came off of our annual nonprofit summit, and our speaker was a gentleman named Bob Lupton from Atlanta, Toxic Charities. One of the things that his key message is parity, not charity, and looking at how you deliver the services to those in need in a way that's less about the handout and more about the job opportunity. So I think that his message really resonated with nonprofits that are saying, okay, we've got to find a way to look at this as a business in the delivery of even the human needs services. We know it's our mission to deliver and we want to be there for them, but is there a way that they can pay a little bit of money? So that finding other ways to finance the needs.
Go ahead, Karen, please.
Well, I think that's also where one of our focus on prevention comes in, because even if you think about the Medicaid and insured, a lot of the expense is on chronic diseases. But if we can get people healthy through healthy lifestyles, diet change, being able to go to their doctor all the time and be checked on, then we can eliminate some of the expense that all of us worry about in Medicaid.
But here's the thing, Karen, and I think you both touched on this point about let's go upstream. We've got the symptoms, but what's the root cause here? So I guess how in this new reality, whatever it is, whether you have more dollars or maybe more focus on strategy, how do you lift your head up from the work at hand to really start focusing on, okay, but why is it that way? What's the root cause? And you're nodding like you've had this thought before.
We have that discussion all the time. There's a poem we use that's called The Fence or the Ambulance, and it's whether there's a town built on a cliff and people keep falling off, and the town had a big discussion on whether to buy a fence or put an ambulance at the bottom. Well, the town decided to put the ambulance at the bottom. Well, as a trust, we've decided we want to put up the fence. We want to keep people from falling off. And so the lack of health care or poor health status of North Carolina isn't necessarily a health care issue. It's an education issue. It's a law enforcement issue. It's a community development issue. And so we're trying to look at that root cause, because we know being poor is one of the reasons people are on Medicaid. And so if you can help them lift themselves out of poverty, give them the tools, whether it's education, whether it's job training, then they won't need those services or won't need them for as long.
So how do you characterize that, Madeleine? I mean, how do you think about that?
Well, in terms of our members, which are nonprofits from across the state, what I see them trying to work on is doing the research to better understand that situation. One of the largest sessions at the conference I just mentioned was on indicators and data, and not just looking at the raw data, but trying, example given, is it the percent that graduate from high school, or is it the number of days that an individual high school is gone without someone dropping out? The different ways of measuring so that you can better understand. Is that it?
Yeah, no, that goes in the right direction. And we're going to bring our guest in here just a second to go to that. Karen, I'll give you the last word. Do you think maybe some of the pain that we're feeling, and in your case is a philanthropic foundation, nonprofit, focused on those who are the least among us, if you will, do you think this pain might have a silver lining in that it redirects the way that you're thinking about going upstream to do just this, about building a fence instead of having to run the ambulance?
I'm hoping that will become the perspective of all of us, not just the philanthropic community, but the social community, the education community. Let's work on best practices that we know are predictive of success, and let's get behind those.
Are you encouraged or are you hoping?
Yes, I'm encouraged and I'm hoping.
Good answer, Karen. Good job. We'll bring our guest on here in just a moment. Next week on this program, he has been here before. Dr. Nita Quabain from High Point University, done a wonderful job to develop that school. But where is that school headed in education? We'll talk to Dr. Nita Quabain next week. And then in 2 weeks on this program, the works of nonprofit and the role that nonprofits in philanthropy has in this current economy will continue. She is the chairwoman of the Duke Endowment from the upstate of South Carolina. Minor Shaw will be back on this program as well. 2012 was a red letter year for the Foundation for the Carolinas. After more than a half a century, really about 55 years, quite frankly, total assets of the foundation hit a big number, over $1 billion. That makes it the 12th largest as measured by assets among approximately 700 community foundations in this country. And that critical mass helps it to do the real work of being at the core of social change in communities. Joining us now is the president and chief executive officer since 1999, Michael Marsicano. Michael, welcome back.
Thank you, Chris. Glad to be here.
Been too long, by the way.
It has been.
But I'm glad you're here. So congratulations, hit $1 billion. That's been kind of a goal, not just in your head, but probably somewhere written on your desk. You got $1 billion total assets. You made $159 million in grants. So how has it changed for you now? Since you have that much money, you've made the largest grant strategy and tactical that you've ever done. How has it changed and why has it changed?
I think that it means that first we have a very generous group of citizens in North and South Carolina who have put money into all those funds that allow us to do more. Some of those are endowed funds that enable us with higher assets to be able to do more for more organizations. And some of those assets come from fund holders who are pouring money into their funds to be able to do more because the economy's up, the market's up, and they have more availability of funds to do things. So it allows us to give a lot more money away than we've been able to do over the last 5 years during the recession.
So specifically, what gets you excited to say, you know, we've got $1 billion now, we've got a bit of a bully pulpit, and we've got some assets. What is exciting for you and your staff to do with that?
If you look at that $1 billion, very little of it is actually in the discretion of our staff and our board. It's mostly coming from fund holders who decide what they're going to do charitably with their funds. And what motivates us is to work with them to make sure that their charitable interests and dreams are taken care of through their accounts. We have a small percentage that is our discretionary dollars, and those discretionary dollars allow us to be very strategic in a few subject areas, specifically in the areas of the environment, youth and children, the demographic changes that we're facing, social capital issues, and workforce development are where we're putting a lot of our time and attention with our discretionary dollars. But for the donor fund holders, we help them do lots of different things, and it's just as much fun to help them do what they want to do as it is for us to decide what we think should be done as an agency ourselves.
Karen?
Well, I wanted to follow up on the discussion we were just having. First of all, congratulations on the milestone that you all reached.
Thank you, Karen.
But I know in the philanthropic community, we talk a lot about philanthropy's role in light of increasing federal and state cuts. What do you think strategically philanthropy ought to be doing as we think this may get worse?
We used to think in philanthropy that we would be catalytic and come up with the answers, and then government would take it to scale. And that's not going to happen. And so we have to think about how we are going to take things to scale that we discover are good results with the private sector to an extent. And that has us thinking about things very differently. It makes you think differently about the investments that you make, because you're no longer investing just for to be catalytic. You're investing for a more long-term result that can be replicated. So replicability becomes a very important priority in looking at grant applications.
So what % of your initiatives involve some governmental component? Are they is most of the work you're doing private sector and philanthropic?
Madeleine, we will partner with government. Let's take a recent initiative called the Carolina Thread Trail, where we put some private investment into the creation of 1,500 miles of greenways and trails in the North Carolina-South Carolina border region. So there's private money that's in that, but it has leveraged significantly more public money as well to make those trails a reality. So a lot of what we do relates to public-private partnerships, but the public dollars have decreased, and so the availability of those partnerships have been compromised.
So the whole DNA at a cellular level, the interaction that foundations and charities have changed since 2008, 2009. And back to your point about how you think differently about making those investments. So how do you argue your point without lobbying? How do you educate? Now, and we'll use North Carolina as an example because South Carolina has been a Republican state for a while now, but North Carolina has a different DNA in its leadership. So how do you argue your point now?
Chris, what we've found is that giving away the money is not enough to move the ball forward. And so we actually created, as a part of the foundation, an entity called the Robinson Center for Civic Leadership. And we use part of our philanthropic dollars simply for the convening role of leaders and citizens in the community to get around the table, to talk about the issues, to be able to collaborate and do joint ventures, because it is so hard to move a ball forward by any one revenue source, whether it be city, county, federal, private sector, corporate. You've really got to have everybody in the tent. And so to do that, it takes a lot more time convening people, getting them in conversations, and then leveraging that action into a bigger pie.
So would it be fair to say that the core of organization like, the Foundation for the Carolinas is the core being a convener in the community?
I would say that about maybe 5 or 6 years ago, we decided that convening and civic leadership was as much a core part of our vision and our mission as is philanthropy. And the results of some of those numbers you spoke to earlier and the growth of the assets actually is because of that civic leadership role coupled with the philanthropy role together that has actually had a lot of people, corporations, put a lot of faith in the foundation of being able, having studied the issues, convening the partners to be able to know the right direction to lead.
I wanted to follow up on with that because I agree with you that even if money were the answer, the philanthropic community doesn't have the assets to solve those kind of issues. And so I think it's important that philanthropy use both its cash and its cachet. And part of the cachet is the convening, but can you give some examples of the other cachet that the foundation is using to advance your mission?
Yes, so we have been long interested in children and youth, particularly with our discretionary dollars, but as I've said, they're small amounts of dollars. So when you're looking at some of our high poverty schools in the region, and in this case particularly in Charlotte, you realize that it's going to take a lot of people to get some of those high poverty schools to a better place. So we launched a project called Project Lift, which is taking 8 feeder elementary and middle schools into one high school, the high school having a 54% graduation rate, disadvantaged group of children, and our goal is to get that high school to 90% within 5 years. It's taken the convening of both corporate, school board, philanthropists, as well as working with the professional teachers and principals to launch that kind of effort. We only put $2 million into that project. It's a $55 million project over 5 years. So it really took the cachet with a little bit of the cash with the convening that leveraged the bigger effort.
Michael, one of the things that we've been struggling with is the concentration of the philanthropy and the nonprofits in the major cities in South Carolina. And I'm sure it's happening in North Carolina. We know North Carolina and South Carolina have recently been among the states with the highest percent increase in the percent of the population living in cities. But when Gene Cochran of the Duke Endowment was speaking to a group of our leaders recently, he talked about this sort of city-state phenomenon. And that for states where still so many people live in rural small towns, the way forward is going to have to include some strengthening of connection between our major urban areas and the rural areas. You serve, I don't even know how many counties. How are you dealing with that urban-rural?
It's a great question. Very strategically, and again, looking for the partnerships. So let's take a city like Rockingham, North Carolina, in Richmond County, the second, I believe, poorest county in North Carolina. They wanted to do a revitalization effort for their small downtown. We linked them with Discovery Place here in Charlotte, and what we now have just opened 3 weeks ago is Discovery Place Kids in Rockingham. 8,000 people have come in within the first 3 weeks from 140 zip codes, all in the rural area.
So you're franchising in a way,
so we franchise
creating chapters of an urban-based nonprofit in rural areas.
Exactly. So you're not duplicating, you're not creating a new nonprofit, but you're franchising is a perfect word.
And linking.
And linking the two.
And going back to Project Lift for just a second here, because you talked about the total numbers. $2 million from the foundation, $55 million total. This is basically a public-private partnership that's focused on a school system within a district.
That's correct.
And is that sustainable?
Well, our hope, our goal is it's roughly, Chris, $10 million a year for 5 years, right? So that for 9 schools. And if we can produce the growth of 54% graduation rate to 90% in that 5-year period, we believe that is such a mandate for the community that we are hoping that then it will be spread across the other schools that are of this poverty level concentration, and that the combination of the different revenue sources will be there if we can prove the results. Now, this is the big test. We could wind up getting the results and not being able to sustain it or keep it to scale, and that is the thing that keeps me up at night.
Is it the wild card that you talked about before about being able to pass this on to a government entity for them to scale it? Is it the political wild card?
I think in part it is, and I think it is possible to consider scaling things with local government more easy than it is with state or federal. And I think philanthropy in its past has tried to do it more with the state and federal level. So on the local level, could our citizens decide, with the results we hope will happen, that they would want to increase the revenues for in the county revenues for the school system to be able to cover the grouping of schools in poverty? I think we have the capacity to do that, but we're not going to do it unless somebody shows results. And we're showing a whole different way to go about it. We're extending the year of the school, which hasn't been available in Charlotte. Which is a major piece of increasing learning. So if those things work, I think on the local government level, they might be able to be scalable in something as important as education and the perceived importance that most citizens have about it.
We have a very similar, or a similar project in Forsyth County that we're calling Great Expectations. That's going to be focused on essentially conception to kindergarten for the next 10 years. And kind of my question is, how will you sustain the community's interest over those, for you 5 years, for us 10 years? Everybody's excited now, but would you advise us to keep that interest up?
I don't think any of these things can keep interest up without extensive civic engagement. And in the case of Project Lift, we are engaging all the neighborhoods and the communities and the parents in a more robust way than had ever been engaged around the schools before. If you don't have that civic engagement and don't put resources towards it, these things can dwindle away, as is human nature, I think. So I would argue that civic engagement coupled with philanthropy is the way of the future to keep things going.
Madeleine, about 2 minutes left.
I'm thinking that many of the people watching the show today serve on boards and volunteer with nonprofits in their community, and they hear Foundation for the Carolinas $1 billion, and they're thinking, oh my gosh, at the last board meeting I was told I had to go out and raise some money. Maybe I better call Michael. For the board member, the volunteer board member, what is just the 2 or 3 things that you would think are the most important in terms of the nonprofit leadership when you're selecting a nonprofit to partner with? How can they be helping?
Yes, I think the selection of the partner, which is very much what we do, is related to the transparency, but this is a big issue with us, the transparency of the information that comes out of the nonprofit.
So good, clean operations you're out front about what your books are looking like.
Exactly. And then the second thing I'd say is I'd almost rather fund an A team with a B idea than a B team with an A idea. Because A team people make things happen.
So it's about the people.
So it's about the people themselves, the leadership of the board, the leadership of the professionals on the agency's staff.
And how much importance do you place on 100% board giving?
I place huge emphasis on that. If we have this peculiar tradition in the United States, we pay to volunteer. We do.
We do.
And that is our tradition. And that shows that the volunteers are so committed to the organization and its mission that they're willing to pay to volunteer. And that pay is that contribution to that nonprofit. That speaks highly to us.
Yeah, thank you. Excellent question. And Michael, I hadn't thought about paying to volunteer, but I will now with my nonprofit commitments. It's good to have you on the program, and best of luck with Project Lift. I know a lot of folks are watching that very closely, and not just in Charlotte-Mecklenburg, but statewide. And
it's gotten a lot of attention.
Yeah, and will for a while. Congratulations again.
Thank you.
Good to have you on the program.
Thank you, Chris.
Madeleine, hope you feel better.
Thank you.
You can't tell, but if I quit calling attention to it, I probably would not even say anything. But thank you, Madeleine, being here.
Thanks
for
having
having
me.
Best of luck. And is it Forsyth or Forsyth County?
Forsyth.
Okay, good. We always get a different answer. Good to have you on the program. Until next week, I'm Chris William. Hope you have a good weekend. Good night.
Major funding for Carolina Business Review was provided by The Duke Endowment, a private foundation in Charlotte enriching communities in the Carolinas through higher education, healthcare, rural churches, and children's services. Blue Cross and Blue Shield of North Carolina. Who's responsible for rising healthcare costs? Join Blue Cross and Blue Shield of North Carolina and many others in a candid discussion at letstalkcost.com. Grant Thornton, an international accounting, tax, and business advisory organization dedicated to serving middle-market companies. Grant Thornton, a passion for the business of accounting. Novant Health, including Presbyterian in Charlotte and Forsyth in Winston-Salem, are affiliate heart hospitals of the Cleveland Clinic, consistently ranked #1 in the nation for heart care. Blue Cross and Blue Shield of South Carolina, proudly serving South Carolinians since 1946. Sunoco, a global manufacturer of consumer and industrial packaging products and provider of packaging services with more than 300 operations in 35 countries. And by viewers like you. Thank you. Promotional consideration provided by Business North Carolina Magazine. For more information, visit carolinabusinessreview.com.